What is diabetes mellitus or insulin dependent diabetes mellitus or diabetes type 2? In this, what happens is your blood glucose is constantly elevated. The reason for this is two. One is insulin resistance, where there is sufficient amount of insulin or more amount of insulin in your blood, still the glucose in your blood is not pushed into the cells and converted into glycogen. This is one of the reasons. And one more scenario is where there is low insulin, the production of your insulin from your pancreas is low. That's the reason the blood glucose is not pushed into your cells and it is converted into glycogen. These two scenarios commonly occur. Either one of them may occur, most commonly in diabetes mellitus 2 patients. It will be a combination of both. We will discuss the symptoms of diabetes mellitus. First one is, the important symptom is the patient may have infections like vaginal infection, fungal infection in the holes, and also he can have blurred vision, itching over the skin, tingling over the skin, and numbness and pain. And also he can have dryness of mouth and dryness of skin. There will be a loss of taste. There will be increased frequency of urination and increased frequency of taking water. There can be increased frequency of taking food as well. Sometimes the patient may lose weight, and also there will be a poor wound healing in case of diabetes mellitus 2. The important symptom of diabetes is infections. The patient undergoes a lot of infections like urinary infections. The patient may go vaginal infections or fungal infections. The main reason for this is when there is elevated blood glucose levels in your blood, it weakens your immune system. So immune system should not be either too much high or too much low. It should be optimized. When there is deficiency or when there is increased immune system, so the patient will get land into infections. Mostly we will see fungal infections, vaginal infections, and urinary infections. These fungal infections are seen in the private parts or the parts where there is too much of dampness or too much of moisture. Weakness, sleepiness, and confusion are some of the symptoms of diabetes mellitus. The reason for this is, even though there are elevated glucose in your blood, the body cells cannot use the glucose and there will be severe dehydration. You will not have sufficient water in our body, because to eliminate the excess glucose, the body will be eliminating water as well. And also poor sleep. If you have good sleep, you will be active. If you don't have a good sleep, you will not be active. Some of the medications used for diabetes mellitus will weaken you, or it will further reduce the glucose levels in the body, which is not available, enough available glucose in your body. And also there will be depression makes you weak. And also heart problems and kidney diseases, where the waste products are not eliminated from your body and the heart functioning is not well. That's the reason you will have all these symptoms of weakness, sleeplessness, or sleepiness, and confusion. The reason for blurred vision when diabetes patients is when there is excess of glucose in the blood, the lens gets swollen. And also due to excess of glucose, the blood vessel supplying to the eye are damaged, and also nerve supplying to the eye is damaged. There will be also dryness due to excessive elimination of water from the body. These are all the reasons that is contributing to the blurriness of vision of diabetic patients. Itching of the skin, numbness of the skin, tingling, and pain sensation over the skin are the common symptoms of diabetes mellitus. The reason for that is the skin will be dry due to dehydration. There can be fungal infections. The nerve innervating the skin may have some derangements or damages. There will be poor circulation of blood within the skin, and also due to kidney diseases there will be accumulation of waste materials within the skin and also other parts of the body. These are the reasons for itching, tingling, numbness, and pain over the skin of the diabetic patients. Dry mouth and dry skin are one of the common symptoms of diabetes mellitus. The reason for this is when there is elevated glucose levels in your blood, the glucose has to be sent out of your body. How is it sent out? It is sent out along with the water. If there is excess elimination of water, along with the water, the glucose is sent out. That's the reason the patients will be landing into dehydration symptoms like dry mouth and dry skin. Loss of taste is other symptoms of diabetes mellitus. This is due to nerve damage. Excess of glucose or excess of insulin within the body or within the blood can damage the nerve endings. This is causing for the tongue to lose its taste. Increased frequency of urination or increased intake of water for the diabetic patients is one of the common symptoms. The reason for it is they will be constantly losing water from the body. When there is excess of glucose in the blood, the glucose has to be sent out, otherwise it will be damaging to the body parts. For that, the body tries to get this glucose out as much as possible. For this, to eliminate the glucose out of the body, the body requires more water. That is the reason diabetic patients feel to drink more water, so that more glucose can be eliminated, and they feel to urinate more so that the more glucose can be eliminated. So these are the reasons for polyuria and polydipsia for diabetic patients. Polyphasia, or taking more food in frequent intervals, is one of the common symptoms for diabetic patients. The reason for this is, even though you have excess of glucose in your blood, the body cells are not able to use it. Either maybe due to insulin resistance, this is the reason. So what happens here is, the body is deprived of energy. To get that energy, body even digests, or body even depletes the protein or muscle within the body, even though it is not sufficient. So the body always feels weak, the body feels to get more food, even though there is high elevated levels of glucose in the body. That is the reason the patient feels like eating frequently. Sudden unexplained loss of weight is one of the common symptoms. What happens here is, when there is excess of glucose in the body cells are not able to use it, and also there will be breakdown of the muscle, as there is no, the body thinks that there is no glucose, and it will also try to get glucose from the muscle, and it will deplete the muscle. There will be increased urination, and that is the reason excess of water is lost from the body, and the body loses its weight. There will be lack of appetite or reduced appetite due to medicines used in diabetes mellitus from allopathy. This is also one of the reasons. And also gastroparesis. What happens here is, the stomach is not able to empty its content into the small intestine. That's the reason you always feel the food is indigested. You may feel nausea and also vomiting. So this explains the unexplained weight loss in the diabetes patients. Poor wound healing is one of the common symptoms of diabetes. What happens when there is wound is, there will be reduced blood supply to the wound. So there will be reduced supply of immune cells or immune modulators to the particular wound. That's the reason the wound will not heal properly. And also there will be diminished sensations. The wound, in order to heal, you should not be touching, or you will not be damaging the wound again and again. When there is no sensations, you may tend to damage the wound or touch the wound again and again. This weakens the wound and delays the process of wound healing. These are the common symptoms. And also, as there is high elevated levels of glucose in the body, it weakens your immune system. With the combination of all these three, the wound will not be healing quickly, and the wound healing is delayed in case of diabetes patients.